Canada is faring better, but the situation is increasingly worrying here too. More than 6,800 new cases have been reported across Canada today. More than 150 more Canadians have died. Most of the new infections are in Ontario and Quebec. But the impacts of the virus are widespread. Here's the map of Canada adjusted for population. Right now, Saskatchewan has the most active cases per capita, 319 infections per 100,000 people. The next hardest hit is Alberta, followed by Quebec, and then Ontario. Ontario's premier says his stay-at-home order, which comes into effect at midnight, is crystal clear. But that is not how a lot of Ontarians see it. There are complaints it is anything but clear about what people are allowed to do or how the rules will be enforced. Our Abigail Bimman went looking for some answers.
Ready to get out, to get fresh air.
And the province of Ontario says under the new stay-at-home order, you can get outside-ish.
You must, I'm going to repeat that, stay home. It's the law, and it will be enforced.
But there were so many questions about what exactly is allowed after Tuesday's announcement. The Premier's office had to issue this FAQ list for journalists Wednesday morning, trying to tackle what's an essential item, trip, and work. But in each case, Ontario cannot determine all the answers, as every Ontarian has unique circumstances and regional considerations.
We need everyone to use their best judgment.
We pushed the province on one big question, enforcement, especially around outdoor exercise. Can you get a ticket for being outdoors, in a park or at a skating rink? Your household may have fewer than the 5-person limit, but what if other people show up too? A government official told Global News bigger groups would break the rules, but enforcement is up to local officers, and said we should direct all questions to them.
We're still unclear. I can tell you that other law enforcement entities, provincially and regionally and municipally, are looking for clear direction from the province.
Neither Toronto nor Ottawa could lay out a plan for parks, rinks, and toboggan hills.
We have asked the province for greater clarity around a number of aspects.
And I hear some elected officials, local ones and other ones, oh, it's confused. Folks, there is no confusion here. It's very simple. Stay home.
Given the bleak nature of our restrictions and what's going on today, giving people the ability to exercise and be outdoors is probably a human right. We should probably be prescribing, given that it's not a particular risk.
We end up burning the public's trust and the public's energy.
Health experts believe getting outside safely is important. Dr. Stephen Burrell provides clinical care to Toronto's homeless population. He's particularly worried about the inequity that persists. Not everyone has a backyard in which to isolate.
I was sort of reflecting on our experience back in March of last year when we had one client who came to us with an $800 ticket for sitting in a bench.
He wants the focus to be on support rather than enforcement. Abigail Bimman, Global News, Ottawa.
Late today, the Ontario government did release the formal stay-at-home order. It's 4 pages long. It contains 29 exceptions to the rule, including going to work, going to the bank, going to the airport, to travel to another province, and walking the dog. In some long-term care homes in this country, the promises to protect residents are being broken. Today, Ontario hit a grim milestone. More than 3,000 residents in long-term care homes there have now died in this pandemic. 40% of homes have active outbreaks right now. For months, Premier Ford has promised he'd do everything he can to stop it. So what went wrong? Mike Le Couteur is looking into that.
If that's required, in my opinion, some homes it's required.
For a moment, it seemed Ontario Premier Doug Ford was again preparing to send Canadian troops to help the dire situation in long-term care homes, saying he was offered the help by Prime Minister Justin Trudeau just an hour earlier.
So I'll take him up on that offer, but I just want to make sure once they come, where they're going and where we're needed most.
But in a statement, the Premier's office tried to walk that back, suggesting the military isn't needed right now, saying, quote, "We will continue to work with the federal government, and if any further support is needed, we will request it." And the confusion doesn't take away from the serious problem facing long-term care homes in Ontario. 249 homes, or about 40% of facilities, have COVID-19 outbreaks, and geriatric specialists are criticizing Ford's claim that he was going to put an iron ring around long-term care centers to protect them from the virus.
Many of us are saying it seems like it's more of an iron sieve because the staffing plans that BC, for example, and Quebec did, where they hired thousands of new workers and made sure that they could be on the front lines ready to go in the second wave, has actually done a lot of good.
Some jurisdictions prevented personal support workers from working at multiple homes to help stop the spread, while Quebec increased salaries and paid for training to attract more employees. But that hasn't happened in Ontario.
She's 82. Before COVID, she was very alert.
Jessica Wong's grandmother caught the coronavirus at the Tender Care home in Toronto, and she wonders why more wasn't done in the second wave to keep the virus out.
If there's no visitation and none of the residents are leaving the home, then it's brought in by staff.
Ford acknowledged that, saying security guards are going to homes to do checks.
To make sure every person that comes in gets checked, to make sure it's documented when they were tested. When was the last time they got tested?
The Ontario government hopes by doing that and ramping up vaccinations in long-term care homes, they'll put an end to the out-of-control outbreaks. Mike Le Couteur, Global News, Ottawa.